Let us look at the muscles of the anterior arm region now. There are three of them and we have to discuss them now. Anterior arm compartment and names. There is one biceps. It is called biceps because it is having two heads and you can see the origin. The origin of the long head of biceps brachii is the supraglenoid tubercle about the glenoid cavity of scapula. And if you are talking about the short head of the biceps brachii, then it is tip of the coracoid process. Tip of the coracoid process. So short head from the tip of coracoid process, yes. And long head from the supraglenoid tubercle of the scapula. Yes, that is the origin of the bicep muscle. Then where is the insertion? If you're talking about insertion, it is on the radius bone. It is on the radius bone and you see this is behind the radial tuberosity. So you're telling that this is the tendon of biceps which is behind the radial tuberosity? Yes, actually in the radius bone. And what is this? This is some bicipital aponeurosis and which is at the roof of the cubital fossa. Tendon of the biceps is a content of the cubital fossa and the aponeurosis is at the roof of the cubital fossa, a space in front of the elbow joint, cubital fossa. Okay, that is the insertion. What is the muscle doing? What the muscle is doing, biceps, yes. It is helping me to use the screwdriver. Use the screwdriver means what? Means number one, it will help me to flex the elbow, and number two, it will help me in supination. It is a powerful supinator. So this is a powerful supinator. Yes, that is what it is doing. Flexion of the elbow and supination of radial nerve joint. Yes, biceps brachii. Okay, what is the nerve supply? You remember there was musculocutaneous nerve supplying three muscles here in the anterior arm region. That is the nerve supply. So musculocutaneous nerve, yes. Where is musculocutaneous nerve coming from? If you remember, there was the lateral cord of the brachial plexus, and it will continue as the musculocutaneous nerve to supply the biceps brachii and the coracobrachialis and also brachialis. You already have seen that earlier. So telling musculocutaneous nerve with the root value C5-6 was compromised in Erb's palsy. Yeah, Erb's palsy we have discussed. It also has C7. And that C7 it was supplying to coracobrachialis muscle, if you remember. So it is continuation of the lateral cord of brachial plexus, and then it's supplying three muscles in the anterior arm, which are coracobrachialis and biceps brachii and brachialis. Yes, it is musculocutaneous because it is also supplying the skin. Which skin? You see, it is supplying some skin also, but as you are telling, it is the nerve which is basically working for elbow flexion and supination, and it is helping me to use a screwdriver. And this is the skin. It is actually supplying some skin. Lateral cutaneous nerve of the forearm. Lateral cutaneous nerve of the forearm. It will supply this area of the skin. That is musculocutaneous nerve supply.